COPD, chronic obstructive pulmonary disease. There are two main types of COPD, chronic bronchitis and emphysema. First, we're going to have a look at chronic bronchitis, also known as blue bloater. Chronic bronchitis is an inflammation of the lung in this area that I've circled around here called the bronchial tubes. So this is a normal bronchial tube, and then right next to it we've got a chronic bronchitis bronchial tube. So as you can see here, we've got a diagram of a normal bronchus next to chronic bronchitis, and on the normal bronchus you can see that there's smooth muscle, there's a nice and clean open airway with nothing in the way of the airflow, and there's a normal amount of mucus glands, whilst on the chronic bronchitis bronchial tube you can see there's clear inflammation and there's also excess mucus because of the increased number of mucus glands, also known as the goblet cells, and this causes the chronic cough that you see in chronic bronchitis patients. The build-up of mucus and chronic cough is the body's natural way of trying to get rid of the harmful chemicals that have been inhaled. So, what are the symptoms of chronic bronchitis? The clinical diagnosis is daily productive cough of 3 months or more in at least 2 consecutive years. The patients are often overweight and cyanotic. They have elevated hemoglobin levels. They also have peripheral edema and rhonchi and wheezing noises when breathing. Other symptoms may include frequent chest infections, slight fever and chills, chest discomfort, fatigue, and production of mucus. So next we're going to have a look at emphysema, also known as pink puffer. Emphysema is a disease that takes place in the lungs, where you can see I've circled around here, in the part called the alveoli. And the alveoli is responsible of providing oxygen to the bloodstream. Here we've got a normal, healthy alveoli on the left, and then on the right we've got a damaged alveoli, so it's an alveoli with emphysema. So it starts out with healthy lungs and healthy alveoli, but then inhalation of harmful fumes and particles and chemicals can get trapped inside of the alveoli and cause an inflammatory response. The inflammatory response dissolves the membranes in the alveoli, giving us a huge air cavity with little elasticity left. So what are the symptoms of emphysema? Well, as you can see here, the pathologic diagnosis is permanent enlargement and destruction of air spaces distal to the terminal bronchiole. The patients are normally older and thin, and they experience severe shortness of breath. On an X-ray of a patient with emphysema, we'll see a hyperinflation with flattened diaphragms. Other symptoms are also frequent lung infections, production of mucus, weight loss because of the reduced appetite, fatigue, sleeping problems, and also morning headaches because of the lack of oxygen during the night. So what are the differences between chronic bronchitis and emphysema? Well, first of all, chronic bronchitis happens in the bronchial tubes of the lungs, whilst emphysema happens in the alveoli of the lungs. In bronchitis, there's an inflammation of the bronchial tube and excess mucus, whilst in the alveoli of emphysema, there is a breakdown of the membranes in the alveoli. This reduces the surface area of the lungs. Here we can see how a typical chronic bronchitis patient looks like, and then on the right we've got a emphysema patient. The blue bloaters experience cyanosis because of the reduced airflow into the lungs. And the name pink puffer comes from the failure to oxygenate the blood properly. Puffer being because the body is compensating by hyperventilating. In patients with emphysema, you also often see a barrel chest, and this is because of it being chronically overinflated due to them not being able to exhale properly. Chronic bronchitis is often onset after 40 years of age, whilst emphysema is onset after 50 years of age. Chronic bronchitis patients have a productive cough, whilst emphysema patients have a dry cough or no cough. They do have a lot in common, so further we're going to take a look at the causes of COPD in general. Smoking is the biggest cause for developing COPD. On the NHS website, it says that smoking is thought to be linked to about 90% of the cases. Also, the exposure to different types of dusts, for example coal dust and other fumes at work, and also air pollution contributes to the worsening of your lungs and chronic obstructive pulmonary disease. Some people also have a genetic alpha-1 antitrypsin deficiency, which means their lungs are less protected and therefore more susceptible to the disease. Patients with this deficiency often develop COPD at a younger age. To diagnose COPD, there's a test that can be undertaken called a spirometry test, and what this does, it tests how well the lungs work compared to normal results for the patient's age. You can also take a blood test to find other conditions that have similar symptoms, like for example anemia or polycythemia. You can also see if you have the polyantitrypsin deficiency, which will then make you more prone to the disease. Also take a chest x-ray to support the diagnosis of COPD. Although you can't always see COPD on the chest x-ray, it might help you show signs for COPD like enlarged lungs or flattened diaphragm. Other diagnostic tests are an electrocardiogram, echocardiogram, peak flow test, blood oxygen test, or a computerized tomography or a CT scan. COPD is an irreversible disease. There are still treatments to prevent it from getting worse. As smoking is the leading cause for developing COPD, it's important to stop smoking as quickly as possible, as it can help prevent further damage. Inhalers are often given out to patients with COPD as the disease often affects the breathing of the patient. Inhalers such as short-acting bronchodilators and long-acting bronchodilators help relax and widen the airways of the patient. Common bronchodilator inhalers are, for example, salbutamol or salmeterol, depending on the severity of the shortness of breath in the patient. Some patients may need an oxygen tank for when they're walking or doing other activities that increase the breathlessness. For severe cases, long-term oxygen therapy in the home may also be needed. Surgery may also be available, but this is only for people with severe cases of COPD who don't medicate their symptoms. Surgery such as a bilectomy, a lung volume reduction surgery, or a lung transplant. For making the best out of living with COPD, it's important that you listen to your doctors, take their advice, and take your medication as suggested. Although you can't reverse COPD, you can prevent further damage. Exercising regularly can also help manage the symptoms of the disease. Exercise can help relieve stress and anxiety, which is often seen in COPD patients. It can also help your breathing, as the extra weight may make it worse. You can find more information about how exercise may improve the symptoms of COPD here on our blog.